This was a very big day. Days like this don't come along in the political calendar very often because you've not only got a Tory government increasing in a big way taxes on income, but you've also got them expanding the state. They were gingerly sort of admitting this in the Downing Street press conference this afternoon, talking about we've expanded the safety net for social care. There is a new role for government. They couldn't quite bring themselves to say it's a bigger state at the end of all of this. There is obviously going to be a big impact, they hope, on the NHS, on queues, on the backlog. What will be the impact of all of this on social care? We know what happens to the punter who might have to pay in to social care now, but we don't know what the product of social care will be like. Social care is getting 5.4 billion compared to 25 billion to tackle those NHS backlog queues. Other big stuff happening today. There was so much happening. The pensions triple lock, as you said, was suspended or downgraded to a double lock now. They said only for a year. But we also heard what the spending round cash envelope is for the next 3 years. And in broad terms, all that stuff you heard being splashed around in there, the money from the tax rises today, that's about all you're going to get. All those other departments who've been struggling with spending levels, the Cinderella departments, way below what they had a few years ago, are going to have a pretty flat settlement. What's the politics of all of this? We were talking yesterday about how an awful lot of Tory MPs were saying they didn't like the look of this, the smell of this at all. They didn't know what party they were in anymore. A lot of them fell quiet today in the House of Commons. Before that, when the Cabinet, those who hadn't been involved in the decision, the wider Cabinet got to hear about all of this. A little bit of what I understand was sort of muted dissidence, but not much more than that. People seem to have been happy with the sweeteners that are around. There'll be a vote tomorrow, so the government's trying to seize the moment on all of that. They seem to have decided that the biggest threat, Boris has decided that Johnson, the biggest threat to him is a Labour campaign based on declining public services at the next general election. NHS in crisis, a backlog. And he's decided that the risk of breaking promises given in the general election is a lot less than that.
Here it is.
Here it is, and there it goes. 20 months after the election, the guarantee not to raise income taxes like national insurance has been scrapped.
Yes, I accept that this breaks a manifesto commitment, which is not something I do lightly, but a global pandemic was in no one's manifesto, Mr. Speaker. This is a tax rise that breaks a promise that the Prime Minister made at the last election. A promise that they all made at the last election, every single one of them. Mr. Speaker, read my lips. The Tories can never again claim to be the party of low tax.
Boris Johnson joined the Chancellor and the Health Secretariat in East London care home to promote the package.
Yeah, I prefer this to my job.
The vast bulk of the £14 billion a year raised in taxes will go on dealing with the NHS backlog after COVID.
I'm not message. Look, we love NHS on social care.
Morgan Vine's family story about care costs is repeated around the country. Her grandmother, Irene, had to sell her house to pay for care, and before that delayed seeking care for fear it would leave her in penury.
She was very, very worried about how much she was going to have to spend, and that wasn't about keeping money aside or having money left to give to her family. That was about her worrying she wouldn't have enough money to live. So it definitely had a huge impact on her life.
The government's more generous approach to how much free social care you can have is meant to address those worries. Under the government's new plan, those with assets worth more than £100,000 will pick up fees for social care themselves. Those with assets above £20,000 up to £100,000 will be liable to pay some of their bills dependent on what they own. If your assets are below £20,000, you'll pay nothing from your assets for social care, but you may have to make some contribution from income. Under a new cap, no one contributes more than £86,000 over a lifetime to social care costs.
So we're doing something that frankly should have been done a long time ago, and share the risk of these catastrophic care costs so that everyone is relieved of that fear of financial ruin.
To pay for all that, employers' and employees' national insurance goes up by 1.25%. Here's what individuals pay on different salaries at the moment in national insurance. Here's what the government just added to tax bills for the different salaries, ranging from £130 a year extra for those on £20,000 a year to £1,130 for those on £100,000 a year.
There are not many people in the Conservative Party, or indeed in government, or indeed in the Conservative Party, who are more dedicated to cutting taxes, bearing down on taxes where we can, than the three people standing before you today. But I absolutely assure you the truth of that. But we face a reality.
For the first time, those in work but above retirement age, who are normally exempt from national insurance, will pay the 1.25% special levy. The government says it makes it fairer on the generations.
Being of retirement age anyway, I wouldn't expect to pay any further national insurance contributions, but hey, at 73, any day now I'm going to need social care, so I'm happy to pay it.
And while I can probably afford to pay more, I don't think everybody can, so I think that there should be a more nuanced approach.
People with a much more of a disposable income should be hit with that, i.e. the higher tax bracket people.
Some businesses say demanding more employers' national insurance off them right now, after COVID, is a big mistake.
It's an extraordinary time to be deciding it's all right to attack smaller businesses, just as we're faced with trying to recover from the pandemic. So it's almost like an increase in a kind of flat tax, almost a poll tax on business, because they have to pay it. Their costs rise regardless of how successful they are.
With the vast bulk of the new spending going to deal with the NHS backlog from COVID, some sense this is a highly political settlement.
There's two big things being prioritised politically here. One is protecting the assets of those who have significant assets and are worried about losing those in the face of the likes of dementia, and then it's about making sure that significant money has gone into the NHS ahead of the next general election.
Boris Johnson said his plans represented a union dividend for Scotland, Wales and Northern Ireland, but they all have more generous social care arrangements in place than England. The SNP called the new 1.25% health and social care levy a new poll tax.
So less than £5.5 billion of the package announced today will be for social care, but it doesn't actually kick in for a few years. And while many social care providers are very happy with anything extra they've been given by the government, many of them are also saying it simply isn't enough. And remember that so many of the people under the age of 65, i.e. not pensions, are also on social care. So what is the future of the social care reform pledge that was made so solemnly again today by the Prime Minister in the House of Commons? Let's talk to our health and social care editor here with me, Victoria MacDonald. Victoria, give us the kind of overall picture of how effective this is.
Well, it can be only overall because we don't have that detail, and I think that was the concern. Yes, there was a welcome that somebody has finally grasped the nettle and how you might raise these funds. Is it enough? Nobody quite knows. Social care once again is being subsumed by the needs of the National Health Service. What we need in the detail is what's going to happen to carers, what's going to happen to staffing levels, which are falling off dramatically. It's the same as we talked about last night with the National Health Service too. What's going to happen with training, care homes? What is going to happen right now? Because, as you said, it's going to be another 2 years before this even begins. Social care is in crisis right now, and there is a real concern about what's going to happen, not just to the elderly, which is where all the focus is always, but also those adults with disabilities.
That's an awful lot of what's. Victoria MacDonald, thank you very much indeed. Well, earlier I spoke to the former Health Secretary, Jeremy Hunt, also, of course, Tory MP, and asked him about his reaction to the package announced today.
I think the government listened to the concerns that me and many other people expressed, that this national insurance, if it was pure national insurance, would be a tax on younger people to pay for things that would benefit older people. This proposal today sees pensioners who work also paying the health and social care levy. It sees it raised on payments of dividends as well. So I think it's a more broadly based tax.
But the 2%, which is what wage earning pensioners amount to, does seem like a bit of window dressing. So I just wondered if you've been bought off by some window dressing here.
No, I think it's very important that everyone should contribute to this, including people who are going to benefit the most. And that was why I was nervous about the original proposals. But I think we've got something here that is going to make a big difference. My biggest concern was to make sure that we were going to see the funding go into the sector that meant that we were going to be treating older people with the dignity and respect that we all want. I think we have a plan that can do that.
We'll get on to social care in a minute, but I wonder if your change of tune, as it were, your championing of the way the money is raised might have something to do with the reshuffle, the possibility of a reshuffle?
No, I don't want a job in the reshuffle.
I'm
sure? Very happy in
fancy going back to the Foreign Office?
I was in the cabinet for 9 years, and I'm very happy being a slightly better dad and hopefully a better husband than I was when I was busy on the front line. No, this is because I have been, since I was Health Secretary, wanting to have a 10-year plan and a long-term funding settlement for the social care sector, just as I secured for the NHS back in 2018. It's very much unfinished business.
But people will only put up with the rise in taxation, which, by the way, for someone, who's 25, over his lifetime or her lifetime, that would be almost £13,000. Whereas, a non-wage earning pensioner, has to pay nothing extra. So I wonder if that will work if people don't feel the benefits. And having been Health Secretary, how difficult it is to convert money into people actually feeling the improvements.
Well, my experience is that there's less intergenerational tension on this issue than people sometimes think, because everyone who's young is hoping to get old, and younger people too.
Hoping to get old?
Well, they're hoping to get old, but, it doesn't sadly always happen because of illness or accidents or whatever. But younger people also have elderly parents and grandparents, and they want to know there's going to be that security when they get older. So for younger people, they can look forward to the prospect of a social care system that is much better at looking after people who need it than we have at the moment.
We've still got a massive hole in the economy because of COVID. We've got a budget coming up in October. Any more tax rises on the menu?
Well, I hope not. And I think...
You hope not?
I hope not. Of course, I don't know what the Chancellor's got up his sleeve, but what I would say is...
But you wouldn't be surprised if there were?
Well, I think the quicker we can get the national finances back in order, get the economy growing healthily, the quicker we can start to do that traditional Conservative thing of thinking about whether we can actually cut taxes, and that's what we would like to do. But I think today has shown that we also have very important social priorities, and at the first...
You're sounding like the Labour Party.
Well, no, I think it's the Labour Party who sometimes try and pretend that Conservatives don't have a heart when it comes to these things. I think we've shown that, the moment the pandemic looks like it might be over, we prioritise the NHS and care system.
Jeremy Hunt, thank you very much.
Thank you.
Well, as Victoria MacDonald mentioned earlier, half the people on social care are under the age of 65 and have disabilities. So let's see how they're affected by all this. Here's her piece.
If anyone knows the social care system, it's Gaynor Griffin. She cared for her mother until her death, and she continues to care for her twin daughters. 21-year-old Hannah and Katie both have complex disabilities.
I was constantly on the telephone asking for help, asking to have a social worker assigned to the girls because they needed support. But there was just nothing, absolutely nothing. In the end, I had to threaten and say it right. After this phone call, I will be phoning every day, and I will just keep on harassing you because I'm not getting anywhere. No one's doing anything.
Gaynor Griffin finally won that battle, but as anyone accessing the social care system knows, it is complex, often frustrating, and always comes at a price. Her family perfectly represents the wide spectrum of people who need this care, the elderly and working age adults, with adults who actually account for half the social care budget.
Thank you, Mr. Speaker. With permission, I will make a statement.
Today's announcement was mainly about the cost, but the Prime Minister acknowledged there are wider problems.
We will also address the fears that many have about how their loved ones will be looked after, by investing in the quality of care, in carers themselves, and by integrating health and care in England. So older people and disabled people are cared for better, with dignity and in the right setting.
Out of the £36 billion from the National Insurance levy, £5.3 billion goes to social care in the first 3 years, starting April 22. The bulk will be put aside for the NHS and the COVID backlog. Was this the revolution in England's social care system that many had hoped? Well, not really. Yes, there is the cap on the amount that any one person will have to pay, £86,000, but in reality that will only affect very few people, those with the highest care needs and those who have to stay in care for the longest. And let's not forget, this does not include the cost of accommodation, the hotel costs. And in some parts of England, those can be astronomical. People being forced to sell their homes has long been an unwanted headline, so the floor and cap was broadly welcomed. Anyone with assets under £20,000 will pay nothing for their care, and those with assets between 20 and 100,000 will be means tested. The proposal by Theresa May that care in your own home should take into account the value of your property has now been consigned, along with her, to the back bench. Much of the detail is still missing, though some is expected over the next few days and months.
A lot of older people and disabled people have had to put up with pretty poor service over the last few years, certainly compared even to the rest of the UK, let alone other countries that have raced miles ahead of us. So we are playing catch up, but better late than never.
You feel that it is in the right direction?
At the moment, it's not clear to us where that extra money is going to have to come from. We think the spending review, the councils can't possibly find it themselves. And unless there is more money in the spending review, the risk is that care goes backwards over the next 2 years. Things will get even worse. And I think following the Prime Minister's announcement, that would be completely unacceptable.
And what matters to people like Gaynor Griffin too will be more help for carers, how the quality of care will be improved and where they will find the staff to deliver that care.